So just want to review some different types of devices we get asked about all the time. Try to keep it real simple. When you hear the word fixed, it means the teeth are screwed down to implants and they don't come out at night. This is an example. This isn't a person or a patient's treatment. This is just a model of a fixed device, a fixed prosthesis. So it screws down, does not come out. You clean this like you clean your teeth, toothbrush, water pick, floss. So when you hear fixed, this is what you're thinking about, something that stays in all the time. In contrast to that, we have a device here. This is removable. So the teeth or the prosthesis device snap onto a bar. In this example, this silver thing here is a titanium bar. This bar is screwed down to your implants, and then there's attachments. These gold buttons here are attachments that allow the device to snap onto the bar. So when you hear removable or non-fixed device, you're going to think about something like this that comes out at night when you sleep or comes out for cleaning. So a denture, if you know someone that's had a denture and they talk about removable dentures, that's what it means. The device goes into the mouth and then comes out for cleaning and care. So we basically have two different roads to choose from. You have a fixed and a removable. Now there's many different types of prosthesis after that. In this example, this is a lower removable device that uses two implants. So this is an example of someone's mouth, the bottom jaw. This is the denture or the overdenture. So it can get very confusing. There's lots of different terms, but this device will snap onto the two implants and does come out for cleaning. The downside of removable devices, bite force is lower. Food will get underneath the devices here, and when you're out at a restaurant and there's food underneath there and you're trying to talk and chew, it hurts, and so you got to run to the bathroom, take it out, clean it out, and then put it back in. So definitely an improvement over a plain denture, having these two implants to stabilize and retain the device in the mouth, but still has some drawbacks in comparison to a fixed type prosthesis that stays in the mouth all the time. The fixed devices, they are supported by the implants. So if you do get food underneath the device and you try to bite down, it's not going to pinch your gums and hurt like an overdenture would. So at Crestline, at our office, we really try to focus on the best products possible. So we really try to help people understand what is the best material. We get common questions about, is it acrylic? Is it plastic? Is it porcelain? Is it zirconia? These are common terms that you'll see online and hear from different providers when you're getting information. So at Crestline, we use a device. For our fixed devices, we use a device that's a combination of zirconia. So in this example here, the pink and white is zirconia that's custom shaded to the patient's preferences. The purple right here is titanium. So in this situation, the titanium, which is typically silver in color, like this device, the titanium is silver. The laboratory has anodized it pink for the patient's preferences. But when you come to our office and you talk about the best prosthesis possible, the best device, we're going to help you understand that zirconia married to a titanium bar is the best. This is the best for longevity, for resistance to staining. So if you do like coffee, tea, dark fluids, this zirconia is going to resist staining and changing colors in comparison to a device that's made out of dental acrylic plastics. These plastics will pick up stain quicker and darken over time. So the advantage of the zirconia is its stain resistance. The other advantage is cleaning. So this material is so hard that it's resistant to food and plaque and calculus attaching to it, so it's much easier to clean at home. With a device that's made out of denture acrylic, denture teeth, which is a good product, however, it just is going to be much more stain prone and difficult to clean. And then lastly, the just the plain hardness of zirconia. The zirconia material is our hardest material that we have in dentistry, and so we feel that this is going to give you the longest lasting prosthesis. Now when you compare a zirconia device to an acrylic device made out of denture teeth, the lifespan of the denture teeth or the acrylic is about 7 to 10 years, and then this prosthesis will need to be removed, refurbished, and then put back in the mouth. Where a zirconia type device like we have here, this material is very hard, and we will see this material last 15, 20, maybe even longer in comparison to a denture type prosthesis like this or an acrylic prosthesis.